So if we put these numbers into a table, we get some pretty straightforward basic rules for ultrasound diagnosis. If we have a rural ectopic patient, one with a positive pregnancy test and symptoms, if the ultrasound finding is an adnexal mass with a heartbeat or yolk sac, we interpret it as definite ectopic. If the ultrasound finding is an extraovarian mass without a heartbeat or yolk sac, a tubal ring or any other one, we diagnose probable ectopic. If there's a moderate to large amount of free fluid in the pelvis, in this rule-out ectopic patient, we would also say probable ectopic. If the ultrasound is normal with or without an intraovarian lesion, we would say possible but unlikely ectopic or can't rule out ectopic. This it corresponds to about a 5% chance. That's why it's possible but unlikely. And finally, if we see an intrauterine pregnancy in this rule-out ectopic patient with positive pregnancy test and symptoms, if we see an intrauterine pregnancy, then an ectopic pregnancy is virtually excluded, but of course we would still check the adnexa in this patient. Now, in the one situation above, where if we have a normal ultrasound in a rule-out ectopic patient, the differential becomes is really what it started at before we did the ultrasound, either an ectopic that we're not seeing, or a failed intrauterine pregnancy, or a normal early intrauterine pregnancy, at least if the beta HCG is less than 1,000. So let's go on to look at some ultrasound examples of these. This is a definite ectopic pregnancy. Here is a coronal or transverse view of the pelvis. You can see the uterus here. It continued there. There was nothing in it, but we see what looks like a gestational sac in the left adnexa. And here on the real-time video clip, you can see that it's definitely a gestational sac in the adnexa, so it's a definite ectopic pregnancy. There's a heartbeat. There's a live embryo outside the uterus. Here's another definite ectopic pregnancy. Nothing in the uterus, in the adnexa. You can see the ovary here, but more importantly, beside the ovary, there's a fluid collection that we know to be a gestational sac. It has a bright ring around it, but more importantly, it has a little circle of a yolk sac. This is an ectopic pregnancy with 100% certainty. What about this woman? She also came in as a rule-out ectopic, positive pregnancy test symptoms. We looked inside the uterus. We saw no pregnancy. We look in the right adnexa in this case. There's the ovary. It has a few follicles. Beside the ovary, there's a fluid collection, bright ring around it. This is called a tubal ring. And when we see this, it indicates a over 90% chance of an ectopic pregnancy. It's not quite 100 because we're not seeing a yolk sac or embryo, but it's high enough, and this woman would be treated in most places, certainly in our hospital, as a presumed ectopic pregnancy because the chance is very, very high. This is another woman who came in as a rule-out ectopic. You can see here the ovary. There's a nondescript mass beside the ovary. Not a tubal ring appearance. It just looks like a solid mass. Since this woman came in with a positive pregnancy test and there was nothing in her uterus, and we're seeing this mass, this indicates and it's a non-ovarian mass, this indicates an over 90% chance of ectopic pregnancy. We're likely looking not at the ectopic itself, but the mass in this case is probably a hematoma from a bleeding ectopic pregnancy. So far I've said that the rules are pretty straightforward, and they are. And in most cases, we can pretty straightforwardly put the ultrasound in rule-out ectopic patients in one of the categories that I talked about. So why isn't it always easy? Well, one of the reasons that it's not always easy is that we sometimes get into a dilemma when we see a mass in the adnexa that we're not sure whether it's in or outside the ovary. We see a mass right up against the edge of the ovary, and it's unclear whether it's really in the ovary or outside the ovary. Here are 3 examples. Here's the ovary, and here's a mass. Kind of looks like a tubal ring, but maybe it's just a corpus luteum. Maybe the outline of the ovary is here, and it's just in but bulging outward from the ovary. And if the ovary comes out to here, this is a nothing. It's a corpus luteum. If the ovary ends here and it's outside, it means that there's a 95% chance. But we're not sure. Not always so easy to tell. Similarly, this fluid collection with a ring, is this bulging out from inside the ovary, or is it beside the ovary? Makes a big difference, but not always so easy to tell. And similarly here, is this thing inside the ovary, if this is the contour of the ovary, or is it outside if this is the contour of the ovary? So that's one of the biggest dilemmas that we have, or one of the biggest difficulties that we have in applying the straightforward rules that I listed on the earlier slide. On follow-up, this patient had an intrauterine pregnancy, so this was presumably a corpus luteum, and these two proved to have ectopics on follow-up. So how do we tell the difference? Well, one of the important rules or ways to tell the difference utilizes the fact that ultrasound is a real-time specialty. The person doing the ultrasound has the probe in his or her hands and can do things with it. And watch what we can do here. Here is a woman who came in as a ruled ectopic patient. This is the edge of the uterus that was out here, but there was nothing in it. When we look at the left adnexa, we can see the ovary and a mass. Is this mass in the ovary? Does the ovary come out to here, in which case this is a corpus luteum? So the ultrasound is basically normal, indicating a 5% chance of ectopic. Or does the ovary end here, and this is an extraovarian mass indicating a 95% chance of ectopic pregnancy? Is it 5 or 95? Big difference. How do we tell? Well, we have the probe in our hand, we can push, and we can see if these move together or separately. And watch what happens. When we push, you can see these move somewhat separately. The mass is sliding along the edge of the ovary, not moving with it, so it's beside the ovary, and we say 95% chance of ectopic pregnancy. So using this maneuver helps us in many cases distinguishing between a mass that's beside the ovary or a mass that's inside the ovary. What about the role of Doppler? I haven't talked about Doppler. Well, Doppler is really not helpful in almost all cases. Doppler is certainly not helpful if we see an intrauterine pregnancy. That tells us already, before we turn on any Doppler, that there's almost certainly not an ectopic. If we see an extraovarian mass, Doppler doesn't help. We already have the diagnosis of almost certain ectopic pregnancy, and Doppler is not going to change from an almost certain ectopic pregnancy, whether we see flow or no flow, in fact. If there's an adnexal mass and we're not sure if it's intra or extraovarian, Doppler won't help, because the Doppler findings in a corpus luteum are very similar to the Doppler findings in an ectopic pregnancy. And finally, Doppler is not helpful if an ultrasound shows normal adnexa. In this case, there's nothing to Doppler. Doppler can even be potentially misleading. If the ultrasound shows an adnexal mass and there's little or no flow on the Doppler, what we're probably looking at, if we see an adnexal mass with little or no flow in the Doppler, it's probably a hematoma in a patient with an ectopic pregnancy. And we expect to see little or no flow on Doppler in a hematoma. So if you believed the Doppler, you would be misled by it. The fact that you're seeing an adnexal mass is already indicative of a likely ectopic pregnancy. Doppler can be helpful in rare situations. The rare situation in which Doppler can be helpful is when the ultrasound is equivocal for an adnexal mass.